98 FM's
Dublin Talks.
Call 6797 981.
And good morning from Adrian Kennedy. How are you this morning? I hope everything is good with you. Now, we've all had a little bit of time to absorb and take in the info from that car crash press conference yesterday, where the government announced its new 5-stage plan. There was a fair bit of confusion. One thing that is extremely clear, though, is that Dublin is a big problem and something needs to be done about the high COVID cases in our county. There I was taking a beautiful stroll on Portmarnock Beach yesterday at around 6 o'clock, and my phone beeped a notification, and the notification said 357 cases of the virus were confirmed yesterday. 218 of them, so well over half, in Dublin. And every day for the last couple of weeks, over half of the cases of COVID-19 have been in Dublin. The eyes of the country are on Dublin. It's become a little bit of an embarrassment, actually, to be honest with you, as a Dub, to see that the cases of COVID-19 are proportionately, dramatically higher here in Dublin than anywhere else in the whole country. 25 counties are doing all right, one isn't. And I and you happen to live in it. People living in Dublin are now being encouraged, just encouraged, not to travel outside the county. And 6 people from no more than 2 households are allowed to visit another person's home. However, here's the thing. It is looking increasingly likely, and the language that's coming out is increasingly strong, that Dublin will be moved to level 3 of the new 5-stage levels. And basically what that means is checkpoints on the Nace Road, is checkpoints to stop us leaving our county. We will no longer, if we move to level 3, be allowed to even go on a staycation. We will be facing what the people of Kildare, Laois and Offaly faced for a couple of weeks. And I'm not happy with that, are you? And the reason I'm not happy with it is because I personally, and just speaking for me, for the last 6 months have done everything that I've been asked to do. Keeping my distance from people, washing my hands, wearing a face mask when appropriate. I've done all the things that we've been asked to do. So I'm a little bit fed up at the thought that other people just aren't. Other people aren't doing what they've been asked to do in order to prevent getting COVID-19 or spreading COVID-19. And all those protesters, 2,000 plus people standing in a huge group across the road from us here at the radio station the other day, barely a mask in sight, giving all the rest of us the 2 fingers. Well, I want to go on a staycation. And unfortunately, because of the behaviour of some people in this city, in this county, I and you and all the rest of us, by this time next week, will not be allowed to leave Dublin. Like, talk about 2 steps backwards. And I want to find out why you think we are in this situation. Why is it? I mean, for example, the very first message we got in, you in Dublin are the COVID-19 All-Ireland champions, as well as your 5 in a row. And that is the fact of it. Because we're now being looked at, we're now being laughed at by the other 25 counties. They're all looking at us and go, ha ha. But here's the thing. It is very serious. If Dublin faces further lockdown restrictions next week, if Dublin gets moved to level 3, it's a step backwards. And it will mean restrictions on our movement. It will mean restrictions on sports. It'll mean literally going back to where we were in probably June. Now, I know you and me and all of us are sick of hearing about this thing. We're sick of it. I'm sick of it. However, the reality of it is that we can control this. We have all the tools. We know what to do. We did it before, and we can do it again. But we can only do it again if everybody starts getting a grip in the next couple of days and stops the spread of this virus. Because, next week we could be at level 3. If we still don't get a grip, we get moved to level 4. And if it still rises, then we're back to lockdown. We're back to not being able to move outside our own houses. I don't know about you. I don't want to go there. Especially with dark winter nights. And horrible rain and not even being able to get out for a walk. The last lockdown was tolerable because the weather was nice. The weather's not going to be nice in October and November and December. Anyway, I'd like to hear from you on 6797 981. This is a WhatsApp voice note from Robbie.
Adrian, like you, I have done everything within my power and in our household to follow all the rules. We had a holiday to France in July and we didn't go. And the little one was devastated. So we booked Centre Parks for next month. And by hook or by crook, I'm not letting the little one down. We are going. And that's it.
And Robbie, look, I get that. But here's the reality. Because of the way in which some people in Dublin are behaving, not going by the rules, not stopping the spread of this virus, you could be stopped at a checkpoint leaving County Dublin next week heading to Centre Parks. And that's the reality of it. Because some people in this city are just giving us all the two fingers. I was walking into a supermarket the day before yesterday. I had my mask on, and behind me was a fella who didn't have his mask on. The girl at the entrance to the shop, now she wasn't security or whatever, but the girl at the entrance to the shop said, "I'm sorry, sir, will you put on a mask?" And his exact answer was, "Off." And he just walked right past her and into the shop. She was powerless. She could do nothing. She's not a security guard. But that was his answer to her. He literally said, "Off." What is with this? And the measures that we have to take are actually simple enough. If we'd all just do it. Anyway, sorry, I'm getting increasingly frustrated. And I want to hear from you on 6797 981. You can text, you can WhatsApp, you can send a WhatsApp voice note to 0877 98 98 98. 0877 98 98 98. I'd like to hear from you. Why do you think Dublin is in the situation that it is in now, facing being moved to level 3 next week, facing you, me and everybody else, 1.4 million of us not being able to leave this county? Neem, you're on 98 FM. How are you, Neem?
Good morning, how are you?
I'm good, thank you. What did you want to say on this?
I actually spoke to you way back at the start of the restriction was in.
Right.
And I kind of heard the thing. At this stage, I think the whole thing has just become a complete and utter sham.
In what way?
There's no clear direction. They're telling us to do this. They're telling us to do this and wear masks, restrict yourself, do all this. Yet no, they can go play golf during the restrictions.
Okay, we know there was massive backlash over all that.
Micheál Martin goes off to Brussels and comes back, and then he doesn't have to self-isolate, even though it's not on the green list.
No, I know there have been, but pointing out all these things is all well and good. They're all wrong. I agree with you. They're all kind of hypocritical or whatever. However, two wrongs don't make a right. Just because somebody else does wrong doesn't mean you can just say,
they're the leader.
I understand that. I understand that. I mean, the golf thing, we saw what happened as a result of that. We saw all the resignations, European ministers losing their jobs, cabinet ministers losing their jobs. That was the reaction to it.
Was it enough?
Well, I don't know. Was it enough?
I don't get it. Like, the thing, I've never seen such a muddle of information with anything to do with this. Like, the virus, you could have it and you don't know because you have no symptoms. Oh, what? How does that work? Like, obviously you have the virus and you have symptoms, because otherwise your immune system has killed the virus and you don't have any symptoms. It's not affecting. We understand the virus is there and it does affect Like, it's affected more elderly people than anything else.
Yes, we know that, yes.
The nursing homes is a massive question mark. How did they get in there when they were in lockdown?
And we have to hope. I'll give you an example. For example, if Dublin moves to level 3 next week, there will be no visits to our elderly in nursing homes. Visits will be completely banned.
At the moment, there's none in the hospitals.
Yeah, no, I understand that. But what I'm saying is that the elderly people will suffer again because visiting to nursing homes will be stopped in Dublin next week. But the point that I'm making is that it's because so many people are just ignoring all this. Like the guy in the shop the day before yesterday telling the girl to F off when she asked him to put on a mask. Now, what is with that?
I can only answer that on a personal level, okay? I don't wear a mask. I don't wear one because they actually drive me insane. I can't breathe properly after about 2 or 3 minutes wearing them.
Okay, none of us like it. None of us like it.
Yeah, the last few months, my mother is in Beaumont, right? She's after having surgery from cancer. I'm not allowed there. I was allowed in initially, and then all of a sudden they closed it down. It became very frustrating for me, but I can't sit there and go, that's because someone else isn't wearing a mask. If this virus is out there, it's just not affecting some people the way it affects other people.
I understand
that. It's
that.
like every other virus. The virus isn't, and it's not. The way it's being portrayed is it's a super bug, and it knows when you've had €9 meal with your pint. That's ridiculous. And all that does is actually make a complete another mockery of the medical science.
Okay, but let me just go back to you for a second, Neem. Just the thing of face masks.
Yeah.
I don't like wearing them either. I got the bus into work this morning for the first time in donkeys and had to wear, obviously, a face mask for the whole journey. I don't like it. I find it uncomfortable, but I do it. Now, are you telling me that you go into a supermarket or into a shop and you don't wear a face mask?
I don't actually go into the supermarket anymore.
Right.
I just do the click and collect.
Okay, so that's fine. That's grand. So you're not blatantly ignoring the rules?
No, I'm not. I'm just avoiding them.
Right, that's fine. That's grand.
That's what you have to do, you know. But at some stage, you're going to go, hang on a second, I'm actually not living a life here because I won't conform with what they're saying. But they don't. Like, I was actually in the High Court in the height of the lockdown.
But again, Neem, I'm going to say to you that two wrongs don't make a right. Just because some people in authority avoided the rules or bypassed the rules doesn't mean the rest of us should do the same thing.
But surely to God, the government and all its officials and all the things should be leading by example, because they're not. They're not leading by example.
All right, do me a favour, stay there for 1 second.
Okay.
I'd love to hear from you on 6797 981. You can text, you can WhatsApp, you can send a WhatsApp voice note to 0877 98 98 98. 0877 98 98 98. Let me play this from Danny.
How we doing, Adrian? Danny here. I think just close the country down for 2 or 3 months like every other country did and get rid of it.
Again, Danny, really? We can't. This country will literally collapse underneath us if we shut the whole thing down again. It will. Veronica, why are you annoyed?
Morning, Adrian. How are you?
Good.
I'm annoyed because one thing you said there, well, that wasn't you, about Dublin. They're going to lock Dublin down and people can't go out. But it's the people coming in. When you said there was thousands in town on the weekend for this anti-hygiene, anti-science demonstration, anti-mask, but they came in from all over the country. So they were busting. A lot of them, I mean, so they've come into the country. So they keep coming in. We go on lockdown. They'll keep coming in. And as they have all during lockdown, getting bigger and bigger. And but that's not going to be any help to us. They need perhaps more fine penalties. They're the same ones who are going on the buses without masks and insisting it's their right. And that our freedoms are being taken away. So it's them lot are the ones that I think should be dealt with.
And in what way? Do you think we should start giving out on-the-spot fines?
Maybe, on-the-spot fines. Or perhaps obviously more solid kind of instructions. It's just so vague, so it's working in their favour, these deniers.
What way? Okay, so on-the-spot fines to punish people who aren't playing by the rules. What else? I mean, why do you think Dublin is looking down the barrel of lockdown restrictions next week? Why do you think that's happening? Is it because people are fed up? Is it because people are just obnoxious and don't care? What is it?
I think, I'd say it's more the second one. They're obnoxious and don't care. And they're getting the ones, people who are fed up are looking at these ones and saying, well, look at them, they've been getting away. So they're joining them. And of course people are fed up. I'm fed up myself. I mean, if we go into lockdown, the next lockdown, I'm back unemployed for a while. So nobody wants a lockdown here. But then, and the one thing that you said is they're going to put checkpoints on people leaving Dublin. But they don't want to maybe put checkpoints on people coming into Dublin. And where are they going? But then you get these people say it's our rights, and then they let congregate in the middle of town. For a week. It wasn't like the first time last week. They've been doing it for weeks, bigger and bigger, and then yet marching through town and shouting at people, remove your mask, remove your mask. They're the pile of sheep walking around with their tricolours on their backs. So they're the ones, and then they're calling us sheep, but they're the sheep. They're the sheep who are going to lead us back into the abattoir.
And you see, this is the thing that concerns me the most, and it's something I actually wrote about in the Herald last week. Okay, if you don't give a damn about the virus, if you don't care, if you're not worried about getting it and all of that, maybe you should be worried about the impact of what this virus is doing. This virus is literally screwing the city that we live in. Dublin is a shadow of its former self.
Yeah.
No, and we're doing that to Dublin because we're not getting rid of this virus.
We're not doing it. You're doing what you're supposed to do. I'm doing what I'm supposed to do.
Yeah, okay.
I don't like wearing
I'm talking about we as in Dublin. We've become the embarrassment of the country at this stage. And the rest of the 25 counties are looking at us and laughing. Because
drinking their pints. They'll be drinking their pints and laughing at us.
Absolutely. They'll be drinking their pints next week. Call me right now on 6797 981. This is Dermot.
Adrian, we also have the biggest population in the country. So... the numbers don't really surprise me. And by the way, like I said before, if the numbers increased, if the deaths increased in line with the numbers that we're seeing, I'd be worried, but they're not. And we're protecting the health system that can't even protect itself against the winter vomiting bug. We've something like 16 people in intensive care in the whole of the country, and we're strained. We're trying to protect failures of governments and health managers for decades. That's all they want us to do. They don't care about the old or the vulnerable. It's always protect the health system. Protect our legacies is what it is.
I'd like to hear from you on how you're feeling about the fact that within days, possibly tomorrow or the next day, Dublin could be raised to level 3 of restrictions, which will mean you and I and every one of us that live in Dublin won't be able to leave the county anymore. So if you have a staycation booked for the end of September, you might be stopped at a Garda checkpoint leaving the county again. We'll take a break. Back in a sec.
The sound of the city, from Donamead to Drimna.
This is 98 FM's Dublin Talks with Adrian Kennedy.
And we're here until midday today. I find myself today a little bit aggravated. I'm not normally in that sort of a humour. I'm normally fairly placid, but today I find myself a bit agitated. That's such a percentage of people in this city of ours just aren't playing ball anymore, just aren't giving a damn about COVID-19. The result of that is that this city, this county, is most likely to be raised to level 3 of restrictions from next week. And that means a huge amount. It means we won't be able to leave the county. It'll mean what happened in Kildare, Laois and Offaly. Garda checkpoints asking you, telling you not to leave the county. It'll also mean, for example, I know somebody in Kildare who, during the Kildare lockdown, went to book a hotel in Waterford and was going to break the rules and was going to leave Kildare and was going to go to Waterford for a little staycation. When she gave her address over the phone to the hotel in Waterford, they said no, they wouldn't take her booking because she was from a lockdown county. So the thought of not being able to leave Dublin next week really annoys me. Mary sent me a message a moment ago and she said, my dad unfortunately died from this virus. No funeral, and we could not see him. Heartbroken is an understatement. I had booked to go away for this weekend and cancelled. Just too scared. Mary, I'm terribly sorry to hear about your dad.
Yeah.
And the funeral.
Absolutely shocking. Shocking. He went into hospital. I obviously won't name the hospital. He went into hospital, not COVID related, and unfortunately got COVID while being in the hospital. Normally I would have been up there every day because my other family members work. So I'd go up during the day, they'd go up in the evenings. Then we were told we weren't allowed in anymore, and I got a phone call to say he was being tested. On the Wednesday morning, I got a phone call to say he had it. Thursday, they rang me and said that we were allowed to go up, that Dad was going to pass away. And the 5 of us went up, and we were allowed to look in through a window. My brother and my other sister went in. I have a very vulnerable son here, so I said I won't go into the room to him. And on Friday, he kind of picked up a wee bit. I rang on Friday morning, asked, could I go up to Dad? And they said no. And I said, how come we could go yesterday and we can't go today? They said, no, that's the rules. We weren't allowed to go. On Sunday night, I was only allowed to ring between 3 and 4 every day. You weren't allowed to ring any other time. I asked them to bring a phone in and maybe take a picture of them or let them hear our voices or something. They wouldn't do anything for us. On the Sunday night, I rang about 20 past 11 and I just said, I'm checking in. The nurse on the phone was quite rude to me and she said, don't keep ringing. We'll ring you if there's any changes. Within an hour, she rang me and she said, I hope you make it. You need to come up. I hope you make it before he passes. My dad was gone. We were allowed to look in through a window at him, myself and my sister and my brother, and we asked them, please let us change his clothes. Can we put on, go home? What do we do? Do we go home and get clean clothes for him, or what do we do? No. And their words to us was, Dad would be put into 2 body bags, put into the coffin, and that was it. Everything that was in his room was burnt.
It was burned?
Taken away, incinerated is what they done with it. We actually got, the only thing they gave us, I asked would they take his watch and his ring off him. And they actually done that. For us to go in, we said we'd go in and wash him ourselves. I'm a carer. I look after my, I have a son here who's paralysed from his chest down. He's terrified to go out into the garden. It took us weeks from the start of this virus for my son to go out into the garden. I'm getting emotional now. For my son to go out into the garden. He's after having life-saving surgery literally a month after my dad passed. We have nothing, only all his jam he owned. We brought him up to the hospital, everything, all his socks, that he had clean clothes, and I don't know if you'd understand, I'm probably blabbering now, but I would wrap his underpants, his T-shirt and his jammy bottoms together. So all they could do was open his drawer and pick out, and that was his outfit for the day. When we went up on the Thursday, and then we went back up on the early hours of the Monday morning, my dad was still in the same pair of pyjamas.
Let me ask you, Mary, then. I mean, you even said in your message that you were planning a staycation this weekend and you've cancelled that because you're so terrified of this thing. How do you react? What is your feeling when we talk today about the fact that Dublin is most likely going to face more lockdown restrictions next week that would stop you even going on a staycation? You won't be allowed to leave the county.
No. I'm actually terrified of it. I cancelled. I arranged for carers and everything to come to look after my son and make sure my other kids were off work, that they'd be here for me to get a break, looking after Dean and obviously with Dad and everything else. And I won't go. I'm not going down and sitting in a hotel in where we were to go. It was actually in Athlone. It was only an hour away, so I knew we could be home within the hour. I'm not going down there and sort of be treated like somebody with leprosy because I'm from Dublin. People just need to realise the damage that this virus is doing to our country, to the people in it, to the older people in it, to the vulnerable people. Just stay at home. Or if you have to go out, just go where you have to go. But just this going out and not wearing masks and these big protests in Dublin because they don't want to wear masks. If you don't want to wear masks, don't wear masks. But don't be telling all us about it. Stay at home then. It's just not fair because all these young ones going out to house parties and not saying where they are, or gangs of them and not caring because it's not going to affect them. Where I have my son in there who is terrified to go out into his own back garden, and we live up, there's 4 houses on the road we live in. We live out the countryside, so we don't see anybody out from my family. And now this lockdown is coming, and I'm not going to be allowed to see my family or invite them into my home, where I need my family around me.
All right, Mary, I can hear your anger. I can hear your frustration. I share your frustration, and I haven't even been through what you've been through in terms of your dad passing away and all that. But stay there for 1 second. Let me talk to Katrina. What are you annoyed about?
Well, first of all, Adrian, listening to that woman, it's a holy disgrace what the government is doing to people like that woman. It's a holy disgrace, and I asked sincerely from my heart for that woman to research the scam that is coronavirus. Coronavirus has been around for generations. My in-law is a lab technician and
Katrina.
It is SARS.
Hang on.
It is SARS, upper respiratory infections
I know
that
what
are
it
not
is.
being treated. They're not treating them with the right medication. How many doctors have spoken out? That woman born and all the stuff belonged to that father. I mean, if that's not horrendous, and yet these governments can go out and play golf, walk around scot-free, 4 and 5 in a car at the time. It's a global reset of the markets. I don't know what else is going on.
Katrina, one of the things that I have despised during this whole COVID-19 pandemic is the spread of misinformation. And I am not going to let you use this radio station to spread misinformation.
Are you saying that 1,700 doctors are liars, Adrian?
I am not having this conversation with you. I'm sorry. I'm not continuing the conversation because I am not going to... this is part of the problem that we're having with this virus. This virus is spreading because people like you who are believing the shite that you're being told. And I'm sorry, Katrina, I know you're still on the line. I'm not talking to you. I am not allowing the spread of misinformation. That is what the problem is. And as a result of people like you and people who won't wear face masks, the rest of us are going to have to suffer. Tanya, you're on 98 FM. Hi, Tanya.
Hi, how's things?
I just have to catch my breath. Yeah, go on. What did you want to say, Tanya?
Okay. I can understand the point that you're making there, and I sympathise with that woman who lost her father. But I think what's forgotten about, and I know COVID, don't get me wrong, is an awful disease, but I really think the mental health in our society are completely forgotten about, and that there's a pandemic there that is completely not reported on the media. The government have never really, they've never funded mental health services. It's so badly, it's unbelievably badly funded. And I really believe they're the forgotten people in society. And we have this COVID, and all we hear about is COVID. And we're here now today, and we're like, oh, the shame on Dublin. What about the shame on Dublin? There is no shame on Dublin. We have such a population.
No. Okay, this population thing, we've had a couple of messages. Hang on for one second.
Yeah, go ahead.
We've had a load of messages in saying it's no wonder we have high cases because we have a high population. Here's the reality of it, though.
Yeah.
28% of the population of Ireland lives in Dublin, okay? So just work with me here for a second. 28% of the Irish population lives in Dublin.
Right.
61% of the cases of COVID-19 yesterday were in Dublin.
Yeah.
That's totally disproportionate.
Adrian, it is Adrian, isn't it?
Yeah.
Adrian, and can you tell me how many people are in intensive care at the moment with COVID?
Not as many as would have been in April or whatever. But the indications are that there are more people now going to hospital with this virus.
Hang on. People are going to the hospital with this virus. People are running out for tests left, right and centre. I've spoken to people and they've been ringing doctors about their children have a common cold, a bit sniffly, whatever, and over the phone, yes, ring such a number, bring the child in, 8 years of age for a swab for COVID. And I tell you, I have had a test before. I was sick before and had a swab test, and it's absolutely horrendous. I've heard of babies going in for swabs, negative results with them, and I know it could be positive. But this is, I think, disgraceful that there's so much media given to a virus that is not wiping out people like we are led to believe. Yet there is a mental health pandemic in this country. How about the family whose brother committed suicide and they couldn't attend his funeral? How about them people?
So what do you propose? We just stop all restrictions and let the thing run rampant?
What about the pressure on the mental health side of the HSE? The mental health have been... The HSE and the people working in the mental health services have been crying out for staff and trying to treat people for years. And now the waiting lists are astronomical. How about we give a little bit of let the media will, and they won't cover that side of it. How about that? There's loads of families, there's loads of individuals. It is absolutely despicable, I think, all of this scaremongering. What about the children's mental health? What about in 10 years' time, the children at 4,
Tanya,
5, 6,
Tanya, can I just... Tanya, can I tell you, hang on, just relax there for a second. Okay. I actually agree with everything that you're saying about mental health and the effects that this pandemic is having on people's mental health. I include myself in that, in the effect that it has had on my own personal mental health. Okay?
Yeah.
But what's the alternative here then, Tanya? Do we just let this virus run rampant and hope for the best?
Adrian, yes. My personal opinion, I am not saying that has to, but I think you have to allow people to start to live. We are not living at the moment. We are existing. That lady, and I know her father passed away and it's horrific, and she's saying people stay at home. How can you tell people in domestic violence situations, how can you tell single parents other people to stay at home? How can we tell... Okay,
but Tanya, Tanya, hang on for 1 second. We can ask people not to have... I was sent a video the other day of a house party here in Dublin with 60 people at the bloody thing. Now, we can ask people not to do that, and they're just given the 2 fingers. That's not too much to ask.
We can, but I believe, Adrian, if the government would take a step back and speak to the people instead of dictating to the people, that we would get a more positive response. What about a bit of positivity? Where is it that we're kind of putting out positive news that so many people, thank God, we have so many people in intensive care, but that we've so many people surviving it. There's too many scaremongering out there, and people are shutting off. We're approaching the public wrongly. We really are. We're not going to get people to listen by dictating on every media channel about COVID. And it's really like COVID's the killer. COVID is this. You know, like I had double pneumonia going back 5 years ago. And I nearly passed away. Thank God I didn't. And apparently pneumonia doesn't really kill. Like COVID is terrible. But the COVID won't kill everybody.
No, of course. You know? we all know that. But that doesn't mean that some people are dispensable.
But they're scared. But the message the government are given, I honestly believe, is wrong. And I think that is why we have what's going on in the country today. That is
all right, and Tanya, unlike our last caller, I'm quite happy to listen to you because you're being rational about what you're trying to say. I don't necessarily agree with what you're saying. I believe we need to suppress this virus in order
we need to be careful, Adrian, approaching the winter months.
Sorry?
We need to be very careful. We need to be very careful approaching winter months. If we were to let people out mixing a little bit more, I honestly believe then, with the weather being a bit finer and that, because we're coming into the, as they call it, sick season, flu season, and you will get some people that may be a little bit more panicky than the other people, and you're going to see a strain then, people will have a bit of the flu or a cold or whatever, and everyone's going to think they have COVID. I do believe we should be mixing a bit more. I honestly do.
All right, Tanya. All right, Tanya, thank you very much indeed for your call. Let's bring in a few more WhatsApp voice notes. This is from Dave.
Morning, Adrian. Just on the Dublin going back into lockdown. Wait till you see all these Muppets now that was out at the protest there, the whole 2,000 or 3,000 of them the last time. Out, no masks, no masks. They'll be the first ones on now to complain that they're locked down. You know, it's because of these gobshites that the bleeding country's not going any further. Can you not just stay in, wear your bleeding mask?
All right, Dave, thank you. Robbie, I know you've been on hold for ages. I'll be with you straight after the break.
The sound of the city from Clondalkin to Clontarf.
This is 98 FM's Dublin Talks with Adrian Kennedy.
We're talking about why Dublin looks very likely to move to phase 3 of restrictions, taking a step back, basically. That would mean that you and I and all of us that live in County Dublin won't be allowed to leave County Dublin. The advice now is please don't, if you don't have to. In the next few days, that will likely change to guarded checkpoints on the Naas Road, stopping you leaving Dublin. And a lot of people are angry because Dublin has become the laughingstock of the country. The other 25 counties are looking at us and going, look, serves them right having their house parties, serves them right gathering in big groups, serves them right for just not giving a damn. And unfortunately, here in Dublin, there is a sizable percentage of our population that don't give a damn. Robbie, you're on 98 FM. Hiya, Robbie.
How are you, Adrian? How are you?
Good, thanks, Robbie. What did you want to say?
Well, first off, Adrian, what I'd like to say is I'd like to give Trina a little bit of an education and let her know that while coronavirus has been around for a long time, there's a thing called different strains of coronavirus.
Correct. And I was going to get into that conversation with her, and I just couldn't be bothered.
There's no point, because you're not going to teach an uneducated person.
Correct.
And there's no offence to that. There's SARS, there's MERS, there's COVID-19, there's different strains, all are more deadly than the other. So there's no point in talking to someone like that when you have that opinion, Adrian.
Mm-hmm. That's why I didn't, by the way. But go on.
Second of all, yeah, I do believe that mental health is a big issue. It's not only because of this, but it's because of other things. So maybe that's a topic for a different day. So just to bring it back to a bit of normality, I can't see what the problem is with people in this city and this country. You're being asked to do 3 things. Wear the mask, wash your hands, stay away from people who don't need to be here.
Not rocket science.
You're not being asked to empty your bank accounts. You're not asked for any personal information that's going to affect you. You have to do 3 very simple things that a 5-year-old child could do. And I don't understand what the problem is with doing it. Whether you have a problem with this government or not, I have a problem with this government, Adrian. But it's very simple. Wear the mask, wash your hands, stay away from people, and you won't go into lockdown.
That's the bottom line. And like I said, and I'm not putting myself on any sort of a pedestal, out of the last 180 days or whatever it is since this whole thing started, I would say 179 days I've done everything I was expected to do, with maybe a slip somewhere along the line.
Adrian, I'm literally parked in the middle of a school now, about to make a delivery. I'm sitting in a van and I won't go out and make the delivery because the kids are in the yard. And I've told the teacher I'm not getting out till them kids are gone inside. It's simple things.
Yep,
I don't understand. People have this problem and they're saying, oh, it's not a deadly virus, it's not a deadly virus. More people die from the flu and more people are going to end up in hospital this time because of the flu and everything. But let me tell them people one thing. There's a vaccination for the flu. There's not a vaccination for COVID-19. And that's why there's a panic about it. That's why there's a panic about it. And you're going into the hardest 3 months now.
Yeah, absolutely.
And people are still not giving a shit. Excuse me language, but you're not being asked to do hard things. Just wear the mask, wash your hands, stay away. Like, we had a conversation yesterday, Adrian, about the roadmap that the government gave out, and we all agreed that the government probably haven't got a clue what they're doing. But at the same time, it doesn't matter what government they're in, whether it's going to be Sinn Féin, Fine Gael, whatever it is, they're all going to ask you to do the same thing. They're going to ask you to wear a mask, wash your hands and stay away from people. So I don't know what people's big worry and fuss is about it. You can blame the government all you want, but at the end of the day, if Dublin or any other 25 counties go into lockdown, you don't blame but yourself.
Yep, and that is the fact of it. And like I said, when you're stopped at a guarded checkpoint on the Naas Road next week, we all have to look to ourselves to realise that this is our fault.
It's nobody's fault but our own.
Yep.
Nobody's fault but our own. It's as simple as that. When your bank rings you up, Adrian, and says to you, you have to protect yourself by not giving your card to people that you don't know. And if you give your card to people that you don't know, what happens? You've no one to blame but yourself. Your own bank will tell you that. If you catch COVID-19 and you pass it on to vulnerable family members because you didn't wear a mask or you had a house party, you've no one to blame but yourself. People can go on and say, this is not a deadly virus, this is all a hoax. It's not a hoax. And as I said to Katrina, it's a different strain of coronavirus that is more deadlier than the ones that came before it. So take care. If you don't want to take care and you catch it and you pass it on to a family member, blame yourself. But it's not fair on the rest of us, as you said, that are doing what we're told and are going to be put back into lockdown, whether it be like it or not.
All right, Rob, let's play some WhatsApp voice notes just to wrap this conversation up. This is from a frontline worker.
Hi, Adrian, how are you? I did say to you there back in last week or the week before that the cases will skyrocket. We're filling up now in the hospitals. The cases we're gearing up for are going to be nearly 500 a day. And then when the pubs open up then in the... not in Dublin, but the rest of the country, it's going to peak again. So he's pouring water onto an oil fire. And this health minister, he's a disaster. He's lost all confidence of the healthcare staff as well. So, great show, guys.
All right, Veronica.
Good morning. Maybe if you want to stop the high rise of COVID in Dublin, perhaps not stopping people leaving Dublin, but stop all the bleeding COVID idiots coming up to Dublin to stand on our streets here and protest about wearing a mask and being against anti-hygiene and walking through the city, marching through the city, and we won't even talk about the rest of it, but they're the ones who are spoiling it for all of us here.
Okay, a few more. This is Donna.
It's people that can't afford to isolate if they do have it. They can't afford to isolate. They have to go to work because they've been out of work for so long, and that's probably what the problem is, and that's how it's spreading, because people are not isolating, they're still going about their business, and therefore it's spreading, and that's why the cases are going up in Dublin, because everyone was out of work for so long.
Okay, a couple more. Jonathan sent me this WhatsApp voice note.
Hey Adrian, the part I don't understand is they're blaming people now without masks, and they're trying to isolate people again, when at the start of all this there was tons of scientists saying don't wear a mask, it doesn't work, and now they're saying it works, you should wear one. They're trying to isolate people and turn them against each other. It was the same when people went travelling. Oh look, it's the people travelling who's spreading the disease and coming back in. And now you look at the cases of, they're mostly communal transmissions now. So now they're not blaming people who travel, now they're pointing out people, it's no masks, now it's you, so it's never going to end.
Okay, let me have a listen to... Oh, sorry, there's loads of them that I'm meant to play. Tracy.
Oh, Adrian, please stop giving her that airtime. I mean, the virus at the minute and the restrictions is bad, but Jesus, listening to people with their conspiracy theorists and their spandemic and all that crappy, stupid, don't get a test that takes their DNA, and honest to God, that's actually more worse for our mental health than the virus itself. Please stop giving her airtime. She drives me mad.
Tracy, for every message that I got saying well done for cutting her off, I've also gotten a message from people giving out the fact that I cut that woman off. I don't want misinformation being spread. Let me have a listen to this from Shelley.
Hey Adrian, just listening to your show this morning, a lot of emotions running high there. I feel that as Dubs we can do this, we can get through it, we can get together, we can get out. We're Dubs, that's what we do. And from the other side, like, I'm in a job that we're about to lose our job, we're in the airport. Absolutely, it is just horrendous to watch so many of my colleagues losing their jobs. I kind of actually feel quite emotional about it. And also, I haven't even had my holidays. I've been working really hard all year. I've been doing a lot in my community as well to help some of our vulnerable people. And now next week, I may not get to go on my holidays. So instead of everybody moaning and giving out about this, why can't we do it?
Oh, don't know what that was at the end. And one final message from Rob.
Hi Adrian, I work in the HSE, and basically I feel that the people who went out protesting with no masks should be ashamed of themselves. We come into work and do our best and, try to protect the people that we care for, and it's just giving us the two fingers. Thanks from Rob.
All right, Rob, thank you very much indeed. And lots of other messages, and I apologise if I didn't get to play yours. It's just been fairly manic. Now, after the break, I want to talk to you about social media. And I want you to just answer this question for me. In the last, let's say, 6 months, have you used social media more or less? Okay? In the last 6 months, have you used social media more or less? Just text more or less to 0877 98 98 98. I'll explain why I'm having that conversation next.
98
It's 11 o'clock across Dublin. Good morning. This is Adrian Kennedy. This is 98 FM's Dublin Talks. And this is Emma with Wednesday's top headlines.
Thanks, Adrian. Good morning. The National Public Health Emergency Team is meeting tomorrow to review whether Dublin should move into level 3 of COVID-19 restrictions. Finance Minister Paschal Donohoe says there's a real possibility it will happen. A cyclist has been taken to hospital after a crash with a motorbike in Dublin City. The man, who's in his 30s, was injured around 6:30 this morning on North Strand Road. The government has deferred a review of the local property tax until next year. There's around 50,000 homeowners who've been exempt from the charge since 2013, who now won't have to pay in 2020 either. And Kim Kardashian West is criticising Facebook and Instagram for helping spread hate, propaganda and misinformation. She's frozen her accounts today in protest and is urging others to do the same. And now you're up to date on 98.
Thanks, Emma. You lead me very nicely into the next conversation that we want to have, which is Kim Kardashian and a number of other high-profile celebrities have announced that they will freeze their social media accounts to protest against the spread of hate, propaganda and misinformation. Kardashian criticised Instagram and Facebook for allowing the spread of hate, propaganda, misinformation. The reality star said she would be freezing her accounts on the social media platform on Wednesday and urged others to do the same. Now, we've a couple of questions for you. Do you believe that social media has affected your mental health? Do you find that spending too much time on social media, looking at negative posts, affects you in a bad way, especially during the pandemic? Are you someone who has deleted your social media account in recent months because you found that it was dragging you down? I know, for example, our Jeremy logged off social media back in May, logged off Facebook, and only went back onto it yesterday for a quick look, and left again after seeing some of the rubbish on it. Facebook this week announced that it's about to add more mental health support tools to its platform, realising that social media during this pandemic has affected a lot of people's mental health. And I want to find out if it has had a negative effect on you. Maybe you shut down your account and it's the best thing you've ever done. We spent 20 minutes on the Facebook timeline yesterday, and it was full of the following: fake news about COVID-19, anti-vaccine groups, anti-face mask groups, negativity about everything. And how can that be a productive thing in your life? I have to be honest, in the last few months, I am using social media less and less and less. And in fact, I very rarely go onto it, to be quite honest with you. Let's have a listen to this from Darren. He got off social media.
Good morning, lads. How you doing? Darren here in Tallinn. Just to say that I stopped using social media when all this started off, when the lockdown first happened. I got away from people's negativity and conspiracy theories about what was going on, because it just goes to show how mad the world has gotten and people out there with their mad thoughts. I took this time to get to know my family. As I said, I was out of work for 2 months because of this, and I spent all this time getting to know my family. And the positive thing out of this is it's brought our family closer together as a unit. So yeah, I think the best thing people can do is stay.
Oh, he got cut off there. Is to stay off it, I assume, is what he was about to say. Thank you, Darren. I'd like to hear from you on 6797 981. You can text, you can WhatsApp, you can send a WhatsApp voice note to 0877 98 98 98. 0877 98 98 98. Tracy sent me this.
Hi, Adrian. Tracy here. Yeah, I've just deleted my Facebook there this week. Just from my own mental health, just getting me down. Just nothing but negativity on it, so I said I need a break. All right, bye.
And in fact, Tracy's on the line now. You decided you needed a break from Facebook. How's that going for you?
Yeah, no, I only did it this week. I just like that. I had read Jeremy's post as well. I'm like, you know what? I just said to myself, he's right. There's nothing but negativity on it, and it's just draining. It's mentally draining as well. I have a young boy to look after. Like, you know, I need to. stay off it, look after him maybe.
And like I said, it is having an effect on an awful lot of people, and it just got too much for you, basically. Just the negativity.
Yeah.
And do you think you'll stay off it?
I'm going to stay off it for as long as I can, yeah.
Is there anything you miss about it?
No, there's nothing on it these days, only but negative stuff. And if it's either that, it's just... how would I put it? Even these quotes that they put up as well, and you're reading them, and there's nothing good on it anymore. Facebook used to be fun, but it's not anymore. It's just not the same.
And but I have to say I don't use it. I've never been a huge user of Facebook, for example, and I've particularly stayed away from it in the last few months, and because I was finding myself getting into arguments with people over stuff that we shouldn't be arguing about, and I've just tried to stay away from it completely, to be quite honest with you. Do you think more people are starting to go that way, that are starting to just get fed up with all the negativity?
Yeah, I'd say so, yeah.
Well, I'd like to hear from you on 6797981. You can text, you can WhatsApp, or you can send a WhatsApp voice note to 0877 98 98 98. 0877 98 98 98. Obviously, social media is important. We use it a lot for this show to reach out to people. But we're not spreading negativity. I hope not, anyway. I hope we're not viewed as that. Angela, you're on 98 FM. Hi, Angela.
Hi, Adrian. How are you?
I'm good, thanks, Angela. Well, you're also sick of social media.
Yeah, I'm kind of, just in the past month or so, I'm just sick of it. Like wanted every now and again if we've gone away, or a couple of pictures to put up or something like that, but I'm just sick to my teeth of all the negativity, and maybe we should be glad that, let's say with the COVID, that the COVID didn't get as bad as we thought it would. People are still giving out about the government and everything, and they're trying to do what they can, and just reading all false stories, and such and such a celebrity has died, and such a celebrity has died, next you find out they haven't, and it's just, and as you say, I'm the same. I get pulled into the negativity and the arguments, and and I'm just sick of it, absolutely sick of it.
And a lot of people, and in fact Facebook themselves, have said that they realise the effect of some of the negativity on their platform and the spread of misinformation. And we had a caller on a half an hour ago who probably gets all of her information off Facebook, and believes everything that she reads on Facebook. And there are loads of people like that.
Yeah, there is. There's a lot more than people would guess, would think, and fair dues to you for shutting her down like that. And it wasn't rude, it wasn't anything. As you said, you're not giving her a platform, because it is misinformation. The thing is, the virus. I know we're kind of off the subject a little bit, but it's still to do with social media. The virus is still there. There is no mixed messages from the government. I'm sorry, I don't think there is. All they're asking you to do is, wear your face mask, do this, do that. That's it. With all the opposition saying, 2 and a bit, for God's sake, stop picking at straws. There's people out there are getting this still, and the numbers are rising. And that's the other positive thing about social media.
And look, I agree that it does have some positives.
Yeah.
But I see so much negativity on it that I just don't bother anymore, and that seems to be why people have moved away from it. I do see nice things. For example, I was looking through My Facebook just now, as I'm talking to you, one of my friends has a post from last night, photographs of the sunset out in Howth, and amazing photographs, and actually beautiful photographs. That's lovely. And then I scroll down just below that, and there's somebody giving out about something. Doesn't matter what it is. Bill, you're on 98 FM. Hiya, Bill.
How's it going, Adrian?
Bill, you actually found yourself using it more over the last few months.
I certainly was, especially during lockdown, but I've been isolated. I've been in my apartment alone since the entire start. I don't have many people around me here locally. So it was a way for me to keep in touch. I went through some real tough patches, being isolated, whether with mental health, alcohol, whatever. Trying to get through it, and the support I got from my friends with it was a positive thing. So in that sense, it really helped me. But I would recommend now going off it, because it seems to be going nuts, especially as we get closer to that American election. There's just so much disinformation, and it seems like it's purposely trying to divide people. That's just the vibe I get. So I've shut it down now until that's all over.
And even though it's the American election, it does the negativity impacts on us as well. The sort of stuff you.
100%. I think it goes globally, right? Because they're still doing that. It seems that's the divide and conquer. People getting aggressively angry over whether we should wear a mask or not, and things like that. And it's just. It seems really like people are getting polarised. It's like nobody can have a decent chat with each other about a topic without completely, they get to insulting, it gets pretty crazy, and I wouldn't want any part of it. I think until people chill out.
All right, Bill, thanks very much indeed. 6797 981 is our telephone number. We're asking, we were talking about the fact that Kim Kardashian and a number of other high-profile celebrities have announced that they will freeze their social media accounts to protest against the spread of hate, propaganda and misinformation. And a load of celebrities are jumping on this whole thing. This is going to really put pressure on companies like Facebook to get their act together and stop the spread of misinformation. Let me have a listen to this WhatsApp voice note from Robert.
Hi, Adrian. In regards that, do I look at more social media? I do, but I suppose I've become desensitised with it. I may pick up the snippets of the daily news or whatever, but I use it just to see how my friends are doing. I feel I've increased my time using social media, but not really for the COVID, just in general. Thanks,
all right, Robert, thanks very much indeed. Jules, you're on 98 FM. How are you?
Morning, Adrian. How are you?
I'm good, thank you. Another one who's moved away from social media.
Yeah, I have. I really cut back more or less right at the beginning, just before we actually went into lockdown, more or less. Because I was just before we went into lockdown, I was just so fed up of all the crap out there that you just saw every second of every minute on the media, in social media, right in your face. So, I don't even do Instagram or Twitter, I just do mainly Facebook. And the amount of crap that was just on there and false information. So right at the beginning, just as we went into lockdown, I haven't frozen my account or logged out, but I barely go into it. And then after a few weeks, I even cut back on TV because I was just so sick of it. And even newspapers, I very read about the newspapers because I'm just sick of all the scaremongering, the crap that's out there. And so I just thought, I'm sick of it. I just don't want to see it anymore. And people are panicking left, right and centre with full of all. And you're like your woman on there was on earlier giving out all the old crap, and like the sofa cutting her off. Because it's just people like her who send people running to the hills screaming, So yeah, I've cut back a lot, and actually I listen to more of the radio and find myself doing other things rather than, going on social media and scaring myself senseless or possibly.
Do you think there's anything that that companies like Facebook can do to make it a more pleasant place to be?
I don't know. Facebook themselves, God knows. I really don't know. In all fairness, I'm not really giving it much thought. Just goes to show because I'm not on there and I'm barely commenting. And it's funny, get friends going, well, where are you going? You just disappeared. You're not on Facebook so much. You're not doing this. You're not doing that. And I'm like, themselves because I've just no interest whatsoever. Really haven't. I mean, I don't know what they can do. I know they've been clamped down on a lot, but there's just so much. I think as well, it's people themselves, the negativity, the scaremongering and listening to it and putting out stupid stuff, and people really take it, and some people are more sensitive to others taking it really to heart, and who aren't maybe able to press that switch flick that switch like a lot of us are, to switch off and just say, it's a load of cardboard, if it's not true, and people just out there scaremongering for crack and just for a laugh, and that else better to do.
Without realising the actual impact that some of that stuff has on people.
Exactly, which some of them will. People who do that suffer with anxiety and I don't suffer with myself, but I can understand
how it would affect people who do. Absolutely, 100%, definitely.
Easily, and even just a little bit with that. I was out only last week where I live in Swords and in the pavilions and things, and people were walking around with, beginning of this one, when we were told to wear masks a few weeks ago, and it was a must, and in shops and things, people were wearing them religiously. I'm seeing them as if some kind of new fashion accessory, just wearing them on the chin, on the wrist, on the handbags, hanging out the pockets, and they're barely wearing them. They were compared to it a few weeks ago. We're wearing them religiously, and people were using the stuff to wash their hands with and things like that. I mean, I suffer badly with eczema, and so I have antibacterial wipes. Shouldn't be using them, but I'm using them because it's better than nothing at the end of the day.
Absolutely, all right. But as regards social media, it's too much negativity on it for you. Connor sent me this WhatsApp voice note to 0877 98 98 98.
Adrian, I think some people just end up getting addicted to it and they're just looking at it too much. If you use it in the right way, I love Facebook for keeping in touch with friends and family that I don't see from one month to the next, and I also have a fishing bio, and it's literally for just I can look back, or my kids can look back in years' time and see that the fish that I've caught down the years, and that's it. And it's all about keeping your account private and keeping the positive people in your life can look at stuff like that, and you don't invite in the public to just bash just for the sake of bashing people. If you use it in the right way, social media is great. It's absolutely brilliant, but if you get addicted to them, you get drawn into these arguments with strangers that you don't know. That's when it gets really toxic. So all in moderation, but if it's used in the right way, it can be a great thing.
All right, Connor, thanks very much indeed. This is Claire.
Hey Adrian, I have to say I've done the same now recently. I've actually got rid of Facebook and Instagram off my phone, and I actually took all the news apps and stuff like that off my phone purely for the fact that I was just finding in the mornings, you go on it for 2 minutes, have a quick look, drains the life out of you, and had me depressed before I even got into work. And not even that, then you have all the news apps coming through and just throughout the days, and it just brings you down. So just clear it off your phone, just take a bit of time, just have a little bit of headspace. Everyone needs it every now and then.
Thank you, Claire. Chris, you're on 98 FM. How are you, Chris?
How are you doing, Adrian?
Good, thank you.
Yeah, I just think now the fundamental issue is what it actually problem is people with the celebrities, right? Because they're watching what the celebrities doing in the first place, and then people are saying, I'm going off Facebook because I feel negative, because they're watching what the celebrity is constantly doing. That's the mentality we're in now.
So you believe that celebrities are to blame?
Sheep factor is to blame. People haven't got a mind for themselves anymore. One, because a celebrity is going off Facebook, everyone else is going off Facebook because of the negativity. It's like with this COVID, with masks and that. Everyone, it's a double standard with masks. I was wearing a mask this time last year going into a shop, and you couldn't go into a shop with a mask. But now, because there's a sudden pandemic, everyone has to protect themselves. But you weren't allowed to protect yourself before that, before that got spread out. This is the whole thing. It's all a big double-headed coin, Adrian, to be honest,
All right, Chris, thanks very much indeed. And let's have a listen to a couple more WhatsApp voice notes. This is Linda.
How you doing? I totally agree with all the listeners. I find Facebook very disturbing. There's so much negativity on it. It's just gone horrendous now. I actually got a link to a guy who had committed suicide live a live stream on Facebook, and it was horrendous. I wish I hadn't seen it. I felt compelled to watch it. I don't know why, but it's kind of playing in my mind now, and I'm an adult. I can't even imagine what would happen if children see this. It's just gone crazy altogether.
I know the video you're referring to, Linda, and I made a conscious decision not to look at it. But it's videos like that they suck you in, I suppose. This message is talking about a Netflix documentary called The Social Dilemma.
Adrian, it's funny how it's brought up this morning there. Only recently there, 2 days ago, I watched a programme on Netflix called The Social Dilemma, and it shows you how all the computer giants, Facebook, Google, TikTok, all these sites and all, coerce you with information and actually does persuade you, and the amount of algorithms behind these that are automatically updating and putting links and all in your thing, just basically on the stuff that you like. The Social Dilemma, Netflix, I'd give it a watch. It truly is an eye-opener.
All right, now our Jeremy has watched it, and he's been at me for the last few days to watch it, so I'm going to make him a business to watch it over the next day or two. And one final message from Jeanette.
Hey, just on the social media topic, I completely disregarded Facebook for a couple of years now. I mean, I haven't been on it for a long time. It's just nothing but the 99% toxic shit, bullshit everywhere you go. Obviously, misinformation is going to be found because you have people who are not doctors, not specialists, but yeah, they seem to know because their friend knows, and their friend has a family member who works in a biology lab or the biochemistry, and they know, or somebody's dating somebody who's a biochemist. All to do with COVID now, but I mean, before that, it was going downhill anyway, so I totally left a long time ago. So I'm not surprised. It's after yourself is after hitting the fan, so I think a lot of people need to step away from social media for a while. Take a deep breath.
Take a deep breath. And like I said earlier, I'm not on it much. I certainly don't do Twitter at all. That's a really, really toxic place. If you want to get involved in toxic arguments, it's horrible. I don't do Twitter at all these days. All right, we're going to take a quick break. And on the way after the break, a story from a man called Alan. And you don't want to miss this story. It's a story that we've never heard told in this way. I'll explain more straight after the break.
The sound of the city from Perrystown to Portmarnock. This is 98 FM's Dublin Talks with Adrian Kennedy.
A man who, with his partner, is going through fertility treatment at the moment, has contacted us wanting to highlight just how expensive any type of fertility treatment can be. He also wants to highlight all the hidden costs involved. And he believes that many couples in this position are being taken advantage of by companies offering fertility treatment because they know how desperate couples are to conceive. In a moment I'll be talking to Alan, but an article from the Irish Times last year read, in Ireland, as many as 1 in 4 couples struggle to conceive. Couples are spending thousands of euro on top of the basic cost of IVF on what clinics term optional extras and add-ons, emerging techniques that have shown how some promising results in initial studies, but have not yet been proven to improve pregnancy or birth rates. In some cases in Ireland, couples are being charged an extra €9,000. And Alan joins us on the line. Alan, good morning and welcome to 98 FM.
How are you, Adrian?
Good, thanks. Now, Alan, take me to the start of your journey here and how it has come to pass that yourself and your partner are going through this IVF journey.
All right. Well, it started a couple of years ago. I got sick and I had to bank sperm as treatment I was going through. It made me infertile. And obviously, we had the only option for us is fertility treatment. So we did a lot of research And we found one that suited us, which is called IUI. It's basically it's just an insemination. So that treatment, it works out around €2,000. And we had started it and we ran out of money. And we got the money up again to do it. And I had researched everything because everyone's going through a bad time at the moment. COVID now, like I haven't worked since March. But we had decided to do this, so we're sticking to it, And
so tell me what it involves. What, having not gone through IVF myself, thank God, I'm kind of unclear as to what exactly it involves. Explain it to me.
Right. Well, at the start, obviously the sperm bank, you have your viral scans to make sure everything's okay with yourself. With me, and everything was fine with me. The count was up very high, and it was banked. And my partner, she has no problem. Like when we were going through it the last time, she went and had a test done. Everything was fine.
Mm-hmm.
So we were going ahead with the IUI, but we ran out of money at the time.
What sort of cost was it?
At the time, we were up to nearly debt. It was around 2,000, and we had ran out of money. That was it. We had ran out of money. We hadn't got the money, and basically it was like, that's it. You haven't got the money to continue. We'll see you when you do. That's fair enough, So we had went to another place before the place that we're with now. They treated us terrible. Didn't like the way they treated us.
In what way? What was wrong with the treatment?
It's just that we went for one consultation, and there's an age gap between my wife and I. There's 8 years, and it looked like the doctor looked at us like, well, these don't look like they're going to stay together. So I think we were married and all at the time, but it was just the impression that we got from the doctor, So I decided I'm not going through. I didn't feel comfortable with them, and we went to this other place. The other place was absolutely brilliant, and we went back again. We had an appointment. We went to see the doctor, and we were sort of dumbstruck because we had set out for IUI, and the cost of that now is around 1,500. And then plus the fertility drugs as well. Well, first thing she said is IVF. We were sort of taken back because we had never spoken about IVF. We didn't need it, So we let her go on, and it was just like it was like a sale. If you go in to buy a car and you're looking at one car and they want you to buy another car, it's more expensive. That's the impression, the way I got it, And I questioned it. So I said, why do we need IVF? IVF is for people that have a very low count, or the woman has a very our ovaries aren't producing enough. And we were told, this is the best way to go. This is the best way to go. And I was like, but we have a plan in our head. There's IUI. And as I said, I researched everything on it. And with IUI, they call them straws. So I have, say I had 10 straws. And for each IUI treatment, it's 3 straws. So they wanted us to use, they were sort of saying you have to use 5 straws for this. Or else you can do the IVF and use 1. And it was sort of like trying to scare us into going for IVF. So I researched it. You only need 3 straws for an IUI treatment. So when I said all that, the attitude changed, and I was like, oh yeah, everything will be fine. It will be grand. IUI is good, We're using it actually a little bit more than we're supposed to. And we're holding stuff, in case it doesn't work. And another couple that we know are doing the IUI as well. They only have to use 1 straw. you know. So it was sort of being pressured in, and then I went in and I was looking at the price lists, and they had for blood tests for me, and I rang them up and I queried them. I said, why do I need these blood tests? My sperm is there already, and I have had these tests done. And then all of a sudden it was a big pedal back, and it was like, oh no, you don't need this, you know. And then down to blood tests for my wife. Just say, I'm just throwing out figures here, just say it was €100 from the fertility clinic. Your own GP, exact same tests, it's 20. But they don't tell you this, you know. And it was only that I said, we want to go to our GP. I've had these tests done already. And it was a big pedal back with them, you know. Everything that she had said at first, which was trying to put us off, was sort of gone out the window, because she realised that we had researched everything. We knew what we were talking about, you know. And it wasn't like we're struggling as it is. But we want to do this, you know. Something that we, you know.
Let me ask you. You're talking about the cost and the optional extras and all of that. Realistically, are you any closer to conceiving a child after all the money you've spent?
Yeah, well, see, my wife is grand. She has no problems whatsoever, and my count is very, very high, you know, which I was told, and I have the proof of it, you know. So we probably have maybe it's 50-50 chance, really, you know. It's hit and miss, you know. But what we said we do the IUI before we consider the IVF, because we're actually perfect, but like we set all the criteria for the IUI. And I was just taken back by the IUI wasn't even mentioned, and it was me that actually mentioned the IUI. We had our own plan.
In fact, I've just gotten a message in a moment ago, and it says, going through IVF at the moment, the financial exploitation of couples is disgraceful. We were told we needed special bloods that cost €300 for us. Turns out I could get them done for €30 on my GP. I would encourage couples to question their bills, and that's exactly the point you're trying to raise here. Let me ask you as well, Alan. Do you think that the state should be helping couples, should be financing this?
Yeah, I think they should. I think it's everyone's right to have a child, you know, and especially like people like myself and that have went through an illness that was made infertile through no fault of their own. You know, it was actually the medication that made me infertile. So the HSE should be sort of partly, you know, like help partly with it, you know, because I know the treatment they gave me saved me, but at the end of the day, it made me infertile. No.
All right, stay there for a second, Alan, because I want to play this WhatsApp voice note. It's from the same person whose message I read out a moment ago. This is from E.
Hi, Adrian. We have uncovered financial exploitation of couples going through IVF. I echo a man that was on. He said that he was charged a lot for blood tests, and we were charged €300 for a blood test. We were told the cost was €300 for two of us to get it done. And actually, when I looked into it, turns out our GP could do it for a cost of €30. What they're doing is they're throwing on a lot of these add-ons to couples going through IVF, and they are things that could potentially boost your chances of getting pregnant. However, when you look at the clinical evidence behind it, the evidence is quite poor. It's quite of low quality, and it's not strong overall. What England have is almost like a traffic light system to help couples be more informed about these add-on costs, because essentially it's not guaranteed and may not increase your outcome at all. So we've nothing like that in Ireland, which is kind of worrying that we're making these decisions based on what we're told. Whereas at least in the UK, they can kind of give this traffic light system: red is no evidence, orange orange is some evidence, and green is that there's a lot of evidence as well. So it's something that we're really lacking here in Ireland. Thank you.
All righty, thank you. And Alan, that's all the stuff you're trying to highlight here. And I just got a message in as well from one of our listeners saying, my wife and I went through the same thing as that gentleman, and it was all to do with money. What do you want to see being done then, just Alan, to wrap this up, for couples like yourself?
It needs to be regulated. It needs to be regulated because it's an unregulated area. Like, I have a price list in front of me here, which was like a semen analysis, which I had done, was €150. Now, I questioned that. And I was like, oh no, we don't need to do that. You know? Like, I'm looking at the difference, the IUI on its own, without the medication and all the extras, is €950. The IVF and the ICSI is €4,500 and €5,000. And we were being pushed towards that, and we didn't need it. We don't need it. You know, like, we fit every criteria for IUI. If it had a photograph of us, you could put us there. We're the perfect criteria for it. You know. Okay,
so you believe that you're being ripped off left, right, and centre, basically?
Yeah. Well, they were trying to. Until I questioned it.
Yeah. I just want to read this message to you. I'm in the doctor's listening to you on my headphones, is this message. Can you please tell that man that my heart goes out to him and his wife who have to go through this route. It's not right, and there are people who are having kids and can't take care of them. It makes me angry that good people can't be good parents, but wasters can, says that message, and I'm sure you'd agree with that. And then another message from John. I can say from my personal experience that there are no hidden costs. Everything is put forward to you. They explain in black and white what is the process, the cost and the chances of being successful. My wife had 2 IVF treatments, and we are happily lucky parents to a beautiful girl. Totally misinforming and negatively a negative opinion from that man. I'm sorry for that man. He has the right to be angry when you're not successful.
It's not about being successful. It's about the hidden costs.
Yes.
I've proven these hidden costs, and they've been taken off the bill because I've questioned them, because I've had them done already. You know. And
okay, let's just have a listen. Let's just have a listen to another message who says it's all about money.
Adrian, these clinics at the end of the day, they've only got one interest at heart, and it's not your best interest. Believe me, they're businesses, and the more that they can sell you, the better it is for them.
Exactly.
Like, you're only your requests and stuff like that. Nah, it's only minor. The more they can get out of you, the bleed you dry. That's exactly how it works. It's like all business.
And that's the point. So you're basically saying to people to question the bills, question what you're being asked to do, and all of that. And one last message, just one last message that I want to play from Michael. Oh, sorry.
I just want to say fair play to that man, because there's not too many men that's going to come on the radio and start speaking about such a delicate issue. Just good on him, because it's usually women that kind of like take the role in that. But fair play to him. Good man yourself.
And Alan, I have to say I agree with that sentiment of that message. Fair play to you for speaking about this. You've raised, and I'm just looking at some of the messages coming in, you have raised a very important issue, and put those thoughts into people's heads to make sure you question things. Yeah,
it's just they have us over a barrel, basically. You know, and it's just I literally went in and I just said I'd read, you know, everything that's on the list that you get, and they give you a fee is right beside it. You know, like a consultation, €150. You sit down and a doctor tell you what you want. You know, like they're trying to tell you what you want when really it's what they want you to do.
Yeah, of course. And like that message said, it's all about money. Alan, unfortunately, I'm out of time, but I do appreciate you talking to us today and highlighting that. And it's a conversation that we may well come back to over the next couple of days. Thanks very much indeed, Alan, for talking to us. You're listening to 98 FM's Dublin Talks. This is Adrian Kennedy with you until midday today. We're back in just a moment with this week's Parent Talk.
The sound of the city, from Furhouse to Finglas. This is 98 FM's Dublin Talks with Adrian Kennedy.
And we're here until midday today. It's time for this.
98 FM's Parent Talk with Super Value Home Delivery. Get your lunchbox fillers sorted with Super Value online shopping.
Every week we are joined on the programme by parenting expert Joanna Fortune, and we take your questions, we put them to Joanna, and we get the answers. It's as simple as that. It's Parent Talk on 98 FM's Dublin Talks. Joanna, good morning. Welcome to the programme again.
Thanks for having me, Adrian.
Lots of stuff to get through this week on the programme.
Yeah.
And by the way, if any of our listeners have any questions that you'd like to contribute to Parent Talk, all you have to do is send us a WhatsApp to 0877 98 98 98. Or you can send a WhatsApp voice note, and if we don't get to use it today, we will use it next week. So, first off, Joanna, a message from a mother and first-time parent. This actually came into us just at the end of the show last week, about disciplining a young child, and in particular, the naughty step. Her partner wants to use this as a form of discipline. The mother isn't so sure. Have a listen to this WhatsApp message that was sent in to us.
Hi, 98 FM. I'm just wondering if you could put a question to your parents and experts on next week's show, please. It's basically how to discipline a child. Myself and my husband are kind of disagreeing on the bold step or the naughty step. So we have a 5-year-old, and lately she's been kind of playing up a little bit. She's, throwing things, having tantrums, just refusing to do anything we ask her. So we're kind of a bit unsure of how we're in a bit of a disagreement about how to deal with it, because he wants to use the naughty step or the bold step. I don't agree with that. I don't like the thoughts of sending her to a step as a form of discipline. I'm just wondering if you've any advice on disciplining children and on the naughty step. Is it beneficial to put a child on the naughty step? I mean, I don't think it is. He does. I'm just, because he's never had to deal with this before, because there's never been any issues before. It's very, very new to all of us. So I'm not sure how to go about it. Thanks a million.
So, Joanna, the naughty step.
I mean, there's a short answer and then there's a couple of answers. The short answer is no, don't do it. I'm not an advocate of it. I think the whole concept of, and you can call it what you like, you can call it a bold step, a naughty step, a thinking step, a timeout step. Kids know what it is. And it enjoyed quite a surge in popularity after particular parenting TV shows, enshrined it as the thing to do. And we have to be aware that when it comes to, any TV show really, you can select families where it does look effective and then make it look like it's 100% effective. It's actually not that effective for most children. And particularly if you have an emotionally sensitive child, because they experience in their already, dysregulated, out of sorts self being pulled away from you. Also, the child in question here is 5 years old. And bear in mind that children under 7 do not self-regulate their emotions. They co-regulate in response to parents, carers, teachers. They're important adults, which basically means that if I'm losing it and my world is coming apart and I'm shouting and stamping or crying or whatever it is I'm doing, maybe all of those things, and you put me somewhere to think about what I did, make sense of it, and then after a designated period of time, which is an abstract concept for me at that age, I'm supposed to make repair with you and say, yeah, I thought about it and I'm sorry about that. At 5 years old, they literally cannot do that. But most children know the way off that step is to use the magic word sorry. But do they mean it? No. Are they going to do the same thing tomorrow? Absolutely. So you're just going to drive yourself crazy with that. So I would always say to you, hold in mind instead, before you move to correction, you have to secure connection. So before you try to correct behaviour, make sure that you're doing that within an emotional connection. And start by acknowledging. Using ACT for me is better. ACT. A, acknowledge the feeling. I know you're really angry because your brother took your toy. Communicate a limit is the C. But we don't hit people in this house. You're not allowed to hit your brother. And then target an alternative is the T. But if you really feel the need to hit something, why don't you hit that cushion over there? Or I'm going to blow up a balloon and hold it away from my body and you can hit it like a punch bag until all those cross feelings are gone. Now you're making sense of it, because as a young child I'm learning I hit my brother because he did something and that made me mad, but actually I have other options. And you're helping them to grow into self-correcting young people as they grow up. I think that's going to be much more effective than just isolating her. But these parents have to get on the same page, Adrian, because this is also an issue when kids see that their parents think differently.
Obviously, that's why that woman reached out to us, looking for advice. So the advice is, firstly, they need to be on the same page, and that the naughty step as a discipline isn't necessarily the way to go.
I would say a no to that, but there are lots of nice creative discipline ways, and I'd go that route instead.
Okay, now another question for you. Sorry, where is it gone? Oh yeah, maybe Adrian, you can bring this up on Parent Talk. How to talk to children about death. We have a 10-year-old and she's quite sensitive. At the moment, one of her grandfathers is terminally ill and is not expected to last till Christmas, unfortunately. She knows he is sick, but doesn't know that he won't be with us much longer. My husband thinks we should prepare her for the inevitable, and we'd love some advice. And that's from Katrina.
Oh, Katrina, I'm so sorry that you're all going through this. That's such a big loss to be facing into. Even with a heads up it's coming, it doesn't make it easier. It's really difficult. And I think when it comes to death, that's one of the trickier parts, that it's a difficult topic for us adults, particularly when it's somebody that we love. And that then affects how we're going to talk to our children, because we grapple with the words. We try to, he's sick, but not sick. Is he dying? We don't want to use the word death and dying. And what ends up happening is children get confused because they're like, what is it you're telling me here? I don't understand. I mean, children actually do have a good understanding of death. By age 4, they have some grasp of its finality. And between 4 and 6, anyone who's parenting that age group, they become quite fascinated with themes of death, even if there isn't that happening in your house. 6 to 9, though, they get a much clearer understanding within that increased focus on physical, biological aspects of what happens after you die. Do doctors cut you open? Do you whatever it is? But there's still that little bit of magical thinking. I wished it. I asked God. I wrote a letter to Santa. Whatever it is that I wanted this to change, and why hasn't it happened? You'll still get that. At 10 years old, your child is capable of an open and honest conversation. And I would always encourage that around difficult topics like death. I think you have to use clear, unambiguous language. Grandad is really sick, and the doctors have worked very hard with Grandad to try get him better, but now we know he's not going to get better. And that means that his long life is coming to an end. And we have some time left, but not a lot of time left. So Grandad is going to die.
Okay, so this lady's message was basically saying that my husband thinks we should prepare her for the inevitable. You would kind of agree with that?
100% agree, because otherwise it's going to be quite a shock when it happens, and give her time to get her head around it. And she is capable of understanding it, but use very clear, unambiguous language, use appropriate words, and don't dress it up, because you're only going to create confusion by using mixed up words.
All right, fascinating as always, Joanna. I look forward to talking to you again next Wednesday on the programme. And if you have any questions that you'd like to put to Joanne around the whole issue of parenting, you can send us a WhatsApp voice note to 0877 98 98 98 or send us an email to dublintalks@98fm.com. Joanna Fortune, as always, thank you very much indeed for joining us. And 98FM's Parent Talk with Super Value online shopping, supervalue.ie. And that's it from us for today. I hope you enjoyed the programme. We're back with you tomorrow morning at 10. If there's anything you want us to talk about on tomorrow's programme, send me an email right now to dublintalks@98fm.com. Carl Dawson is in this afternoon for Barry Dunn, and in the next hour he's got some great music lined up, like these.
We're beautiful like diamonds in the sky. I'll be singing la 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 la.
98 FM.